colleagues, Doctors Mitchell and Meredith, who are integrative medicine physicians at Jefferson. They're going to talk to us about what integrative medicine is, how that relates to healthy aging. So I'm going to mute us for now. Doctors Mitchell and Meredith, how would you prefer to do questions? Do you want to wait till the end?
I think that's best.
I agree. All right. So we will hold questions till the end. I'm going to mute us and I will let you all roll. Thanks so much for joining.
Thank you, Dr. Danilowitz. We're really happy to be here. I am a physician and assistant professor at Jefferson, meaning I see patients and I work with training doctors. And, as much as possible, we want to use these opportunities to talk to the community as well about what we do. So really happy to be here. And then Dr. Meredith is actually a fellow in our department. She's about halfway through her year-long clinical fellowship with us to become an integrative medicine specialist. So thanks for having us. I wanted to just start by, in a few words describing what integrative medicine is. I think a majority of this talk today is going to be doing a deeper dive into that. But just at the onset, integrative medicine is a medical subspecialty, and we add value to the rest of the medical model that exists today, in a nutshell, because we offer specialized, individualized, really targeted, in-depth assessments, and then offer as well unique treatment options that are appropriate. And these are really for patients who either hit a wall with their medical care, who are looking for other options that might make sense for them, or for those who are, really just looking to optimize preventative strategies. So that's kind of big picture what integrative medicine is. And Dr. Meredith is going to go into some more of the specifics.
So hello, everyone.
There you go.
All right. So following up with what Dr. Mitchell stated about what integrative medicine is, we'll do maybe a little bit more of a granular description of our field of medicine. So it's actually, I think I see better with my glasses off. It's a comprehensive approach to taking care of individuals and patients. There is a philosophy where we combine conventional medicine, which you may recognize more as Western traditional medicine, but now we combine it with science-based complementary care. And as Dr. Mitchell alluded to, precision therapies to help optimize healing outcomes. We like to focus on the whole person. So instead of just addressing symptoms only, we bring in mind, body, and spirit, because we recognize that all of these pieces make up the individual, and that also includes wellness and illness. And then through these, we also optimize health. So there's the focus on not just treating illnesses, but the prevention and maintenance of care, and optimizing health with special attention to lifestyle choices. So as we mentioned, integrative medicine, we bring in combined conventional and integrative pathways. And this is a really nice diagram that was created by the National Institute of Health, their National Center for Complementary and Integrative Health. And so this is like kind of an overview of the different modalities that we use in integrative medicine. So we don't ignore conventional medicine. So prescriptions we still do, such as drugs, surgery, if it's what is indicated for best care of the patient. But we also bring in nutritional food as medicine. We bring in things such as probiotics, prebiotics. We sometimes will use herbal medicine, supplements, vitamins, and we mentioned about mind and body. So that can be through meditation, mindfulness, breathing exercises, and different therapies such as art, music, and dance, and acupuncture and massage. So we kind of, again, it's about what are the best ways to help our patients, what are the best ways to care for ourselves. And so we use all these different pathways. So the principles of integrative medicine, so it's a healing-oriented care. We focus on supporting the body's innate healing capacity. I think we've kind of gotten away from that, but our body is an extraordinary thing, and we have innate healing mechanisms. And so we like to support it and optimize it. And again, it's not just about suppressing symptoms or addressing symptoms. We have a holistic approach, which again, we address emotional, spiritual, and social and environmental factors that profoundly influence and impact our health outcomes. We use nature and nutrition, which in some instances, it's less invasive compared to conventional treatments. We use food as medicine along with supplements when it's appropriate, while also trying to take care, make sure that they're effective and safe for our patients. And again, we come back to that prevention. So we emphasize health promotion and disease prevention alongside treatment of actual conditions. So why does integrative medicine matter? So we're in a time where we have more chronic illnesses. Individuals are living longer, but they're living longer with chronic diseases. And there have been studies to show that many of our diseases, many of our chronic illnesses can be tied back to stress. So integrative medicine is essential in addressing chronic diseases and stress-related illnesses, which are increasing around the world. And then also bringing in new approaches that addresses root causes and not just symptoms. There's the challenges. Many of us have been frustrated at times when we only have access to conventional care. And sometimes you may be left feeling as though the care is impersonal or incomplete. So we bring in a more comprehensive care. And then integrative medicine also allows patients to kind of take charge of their own healthcare. So through nutrition and exercise and movement and supplements, and being able to kind of know right away what may be working for you over time. So integrative medicine offers greater patient autonomy, holistic care options, and an active participation that patients can take in their own healing journey. So you may be surprised that you either may have already participated in or just be familiar with what is some integrative therapies. Acupuncture, which is an ancient practice, which is used to reduce pain, nausea, and other symptoms. Studies have shown that it is really beneficial for patients who have cancer and may be undergoing chemotherapy. Not that it replaces chemotherapy, but sometimes the adverse effects that a patient may be experiencing because of treatment. Certain mind-body practices such as meditation and yoga and Tai Chi, these help reduce stress and lowers blood pressure and enhances overall psychological well-being. Dr. Mitchell alluded to the precision care that integrative medicine offers, and that includes the nutritional counseling. So there's personalized dietary strategies designed to boost immunity, increase energy levels, and support healing processes. And then massage therapy, believe it or not, is an integrative approach. It may relieve muscle tension, improve circulation, reduce anxiety, and promote deep relaxation. So kind of leading into that, some of the approaches that you may already be familiar with, this again is also a diagram and data presented by the NIH, where this shows the 10 most common complementary health approaches. This dates back to 2012, but you can see that many, and these are Americans, many Americans are already using these practices to help complement their health. So natural products, which would be outside of vitamins, but things such as fish oil, adaptogens, which are herbal practices, things such as deep breathing, and we talked about movements such as yoga, Tai Chi. And so you see here on the list, that people are already using these practices to kind of help optimize their health. So there is a lot of information out there, but we really do strive to use science-based medicine. So there is a growing body of research being done to make sure that what modalities we use for our patients as it pertains to integrative medicine is safe and effective. There are studies that have shown the importance of mind-body connection, that we can't separate it, that they really are all one, and it directly influences physical health. And then personalized medicine, which kind of keeps coming up, that we're all different. We have different genetic makeups, we have different biological backgrounds, and so research is being used to see how we can personalize these things, different genetic pathways to optimize health. So for our group here today, we wanted to kind of talk about some strategies about enhancing longevity and wellness as we age. So what is healthy aging? So using a holistic approach, we want to focus on maintaining physical, mental, and social well-being while emphasizing quality of life, good quality of life, and longevity. There are some key lifestyle elements that we hone in on, which is balanced nutrition, regular exercise, restorative sleep, stress management, and social connections, which are all essential for promoting healthy aging. The integrative medicine approach promotes prevention and personalized care, which we've mentioned before, to address these different dimensions. And we also want to reduce chronic disease, the risk of chronic disease, such as osteoporosis, dementia, cardiovascular issues, and while supporting functional ability. So we've kind of broken out on some of the more important categories that become impacted as we age. And we like to offer different strategies to support vitality and well-being, such as optimal nutrition. So we really promote a nutrient-dense diet, a whole food diet, lean proteins and healthy fats, such as olive oil, to reduce inflammation, support energy, and provide essential vitamins and minerals for longevity and overall well-being. One of the things we also really encourage is to lessen the intake of processed foods. Bone health becomes very, very important as we age due to hormonal shifts. Our bones are not the same as we get older. So we like to focus on strategies which will maintain structural integrity and lower fracture risk through calcium intake, vitamin D, weight-bearing exercising, and strength training. Brain health is very important. Many of us become concerned on what our brains will be doing as we get older. So we like to offer techniques for cognitive resilience and mental stimulation, stress reduction, and promoting omega-3 rich diets. Physical activity, movement through life is very important. And as we get older, we want to promote activities which enhance strength, flexibility. This actually also improves mood. And we want to focus on resistance training and mind-body exercises. Quality sleep becomes really important. We know that as we get older, sometimes sleep becomes more of an issue, but it does remain important for memory, cognitive function, immune support, emotional balance, and physical recovery. And then lastly, social connection. So social connection has been shown to promote emotional well-being, longevity, improved mental health, and this is done through developing and maintaining strong relationships. So we'll go a little bit into detail. We'll spend just a little bit of time on each of those topics. We'll talk about first bone health. So some specific strategies that we like to promote bone health, which is nutrition. So we talked about calcium, so eating calcium-rich foods, having your vitamin D levels checked by your physicians, and then optimizing it. protein intake, which supports bone mineralization and muscle strength for healthy bones. Exercise, so the type of exercise we do for bone health is important. And this is weight-bearing exercise, such as walking, playing tennis, weightlifting, and then balance exercises also to stimulate bone remodeling and reduce fall risk. Something very simple to work on your balance is standing on one foot while you're brushing your teeth in the morning and then switching. So you can work on balance exercises as well. Mind-body practices. We want to work on techniques that will lower stress. And these are done through mindfulness exercises and physical activities such as yoga, which lowers cortisol, a stress hormone, which then helps prevent bone loss. And then an anti-inflammatory diet. So again, we're looking to kind of reduce the inflammation in our system, which then may go on to support healthy bone turnover. We mentioned before how the importance of sleep. So there's a phrase that we use called sleep hygiene, which may be new to some of you, but we do use hygiene around sleep as far as what does our bedtime routine consist of. So we encourage consistent bedtime routine. So for those of you who may still be working, those days that you have off, you want to keep the same time that you go to sleep and the same time that you wake up. You want to limit your screen time. And that includes, if possible, removing any screens from your bedrooms and promoting a cool, dark room to promote restorative sleep. Lifestyle and herbal support, so physical activity earlier in the day helps, and then herbal teas such as chamomile and lavender may help support better sleep. Circadian rhythm, so this is the internal clock that we have to kind of tells our body when it's time for bed and when time to rest, but it actually begins during the day. So exposing yourself to morning sunlight shortly after waking helps reset your body clock, and then it helps with the sleep-wake cycles throughout the day. And then we've talked about mind-body relaxation. So for those of us who may struggle a little bit with falling asleep and staying asleep, practicing breathing exercises, muscle relaxation, through things such as a body scan and mindfulness helps to reduce stress, which may better enhance your sleep. And we come back to brain health. So there are some things that individuals can work on to help support and strengthen brain health. We come back again to nutrition, which is a core principle for us in integrative medicine. So diets rich in fruits, vegetables, whole grains, omega-3s that come through Mediterranean diet. Omega-3s are also found in things such as walnuts and fatty fish, such as salmon and sardines. But these have been shown to reduce dementia risk and protect against oxidative stress. Again, physical movement is also a core principle for us in integrative medicine. So aerobic exercise may enhance cerebral blood flow and also encourage neuroplasticity. And strength training also supports metabolic health. There are some things that you can do to stimulate your mind. We talked about certain cognitive activities and mind-body practices, but you can also challenge your brain. So learning new skills, such as learning a language, learning how to play a new instrument, solving puzzles and reading helps build and maintain cognitive reserve. And then we come back to social engagement. Social interaction, relationships protect cognition. Isolation has been shown to, has been linked to cognitive decline. And then again, quality sleep, which is vital for brain repair and optimal functioning of our brain. Just in general, some dietary suggestions. We really promote diets that will help keep inflammation in our bodies down. And this also then will help lower the risk of heart disease and diabetes and cognitive decline. We talked about the Mediterranean diet, which is a diet rich in fruits and vegetables, nuts, olive oil, and healthy fats, which reduces inflammation and supports longevity of life. anti-inflammatory nutrients such as omega-3 fatty acids, which again, those fatty fish that we talked about, sardines and herrings and mackerel, as well as flax seeds and berries and green tea. These also help with inflammation, and they're also antioxidants. And then, we want to limit intake of processed foods, refined sugars, foods with trans fats, which actually are pro-inflammatory. And think of movement as medicine. We alluded to food as medicine, but movement can also be medicine. This is something that can be prescribed for you, depending on what you're trying to accomplish. But the benefits of physical activity in general, it supports cardiovascular health, bone strength, cognitive function, emotional well-being. You want to incorporate these and become consistent with these: aerobic exercise, resistance training, flexibility, and balance practices. And then, if possible, you can do them in groups, which you then kill two birds with one stone. You have you're working, you have relationships, and you're also doing physical movement. So relationships in general, so the importance of social connection as we age. Meaningful relationships do reduce mortality, and it improves cognition and emotional health. We mentioned the risk of isolation. So it has been shown to increase the risk for depression, dementia, and cardiovascular disease in older adults. There is importance, if possible, to come together as a community, but to come together even with different ages. So participation in group activities and intergenerational groups fosters resilience and purpose. And then we come back to mind-body practices, which is another core principle in integrative medicine. Things such as group yoga, meditation, and digital communication, although we want to be careful with that. But sometimes if your family is, not near, there is still a connection, and family and friends, sometimes by just doing FaceTime or speaking to individuals, it may help maintain physical, social, and emotional wellness. So in general, some takeaways for healthy aging. Again, this is a holistic well-being approach. We integrate physical, mental, and social well-being to promote resilience and vitality. We talked about different core principles that we there was a theme to it: bone health, brain health, sleep, nutrition, physical activity, and social connections support healthy aging. We want to develop preventive strategies, which is possible, to reduce chronic disease risk and enhance life quality. And then we benefit from the rewards of it. So it brings independence, cognitive clarity, and emotional well-being. I think the next, I'll turn it over to Dr. Mitchell.
Thank you, Dr. Meredith. I think that was a really great overview of common approaches, core principles of an integrative approach. And I wanted to take some time now to talk about our clinical practice at the Marcus Institute of Integrative Health, how we apply integrative medicine in our practice, and then help you understand how that might fit into your existing medical care, and hopefully give you some opportunities to potentially connect with us. So in 2019, we launched the Department of Integrative Medicine and Nutritional Sciences at Thomas Jefferson University. And this was a really exciting point because this was the first medical school department of this kind in any academic medical center. And from what I understand, it's still the first of its kind. And so this is exciting because we sit as a department next to, the Department of Cardiology, the Department of Family Medicine, the Department of Surgery. And so we really have kind of a place at the table at Jefferson because integrative medicine approach is something that, in the scheme of things, it's new, but it's also old, right? These approaches have been around for years, and they are effective. However, they haven't always really found a way to make themselves to have a presence in our current medical model. And so we're very excited to kind of have that opportunity at Jefferson to do research behind these approaches, which we know is very important in kind of the medical space. We're excited to be able to train doctors and medical students, and then to be able to see patients as well. The clinical arm of our department is called the Marcus Institute, and we have 2 clinical locations in Center City, right on 10th and Chestnut, and one in Villanova as well, kind of serving more of a mainline community there. Within our academic department, we offer a lot of educational programs. We have graduate education programs, including kind of master's certificates. We have a fellowship, and then we have a lot of kind of educational opportunities for the public as well, which I'll get into. So in terms of our clinical practice, so we are mainly an outpatient consultative practice. And what that means is that we're not primary care doctors. We don't really see patients for that or for acute care. We work alongside your primary care clinicians, your specialists, your cardiologists, your endocrinologists, not to replace them, but to really enhance outcomes by making sure that all of the approaches that are taken towards your health and well-being are all aligned. So your conventional medications, your complementary therapies, what you're doing day in, day out in terms of lifestyle. We want to make sure at our consultations that we understand what's happening and that all of it is kind of serving the greater purpose, which is health span, as Dr. Meredith outlined. Within our clinical practice, we have a handful of clinical providers, and they're from a variety of specialties. So I have a family medicine background. We have neurologists, we have psychiatrists, psychologists, we have oncologists as well. And so we really kind of try to tailor the doctor that you see within our practice to what your particular kind of needs and concerns are. Many of our patients kind of seek us out because they've heard of integrative medicine, or they might have a friend who's seeing an integrative medicine doctor. So many of our referrals actually come from the patients themselves, but more and more we're getting primary care doctors and specialists also sending their patients in when they feel that there's just an additional kind of layer of care coordination, maybe more of an attention to some of these root causes of chronic disease that needs attention. In this way, we really like to think of ourselves as filling in the gaps. So, our visits are long. We have ample time with our patients to really assess and optimize areas that traditional visits often cannot fully address. And it's not often it's not that the providers don't want to address these topics or give this type of care. There's often constraints in terms of how long the visits are and what's kind of reimbursed in a typical medical model. So for that reason, because we like to give our time and really hone in on some of these areas, most of our patient visits are paid a fee for service. So that's just something to be aware and and that is something that differentiates us from majority of the kind of clinical practices at Jefferson. Another, I would say, kind of area to emphasize that we really try to be diligent about in our clinic visits is to stay on top of the available clinical and scientific research, because patients come to us kind of asking, what's next? What else can I do? Is there anything that I'm already not doing that might be of benefit to me? And it's really our role as integrative medicine specialists to be able to kind of analyze the existing research and evidence and be able to have a very nuanced risk-benefit discussion with our patients. And I'd say one of the really exciting parts about being in this field is that our care is applicable to a wide spectrum of people. So we, during a typical clinical day, we're seeing people who are generally well and who want prevention from, very common chronic diseases in our country, whether that's heart disease or diabetes or dementia. We also see patients who already have those chronic diseases to some degree and who want to take a step further past maybe only medication management of these conditions. So that's a typical reason for patients to come in. And then I'd say lastly, we do have a good amount of patients who have significant illness. Maybe it's cancer, maybe it's progressed cardiac disease or something like a neurodegenerative disease like Parkinson's, for example. And we work along with their specialists to help layer on some additional treatments and to make sure that the outcomes are best for the whole team. During a typical visit, because a lot of people are kind of interested in what the specifics are, we have a pretty in-depth intake process and do a very detailed history and physical. We like to kind of look through existing records, existing care, and see what's already been done and what we can add to that. We spend a good amount of time, like you just heard, doing a deeper dive into lifestyle assessments, offering modifications there, recommending appropriate complementary therapies. And a lot of our patients come to us actually looking for kind of more precision medicine assessments. And we do these when appropriate in certain areas. So we look at genomics or nutrigenomics, which is an assessment of genetic variants that when present in certain kind of groups and pathways can actually affect a lot of everyday things like your micronutrient needs, what particular diet might be the best one for you, how you metabolize or respond to very common medications. It turns out that genes are really foundational for all of these things. And there are now genetic assessments that we do in our practice that can help us personalize these things. We also look into gut health and the microbiome in a lot of detail. There's fascinating science being done on this topic, and we're learning more and more how important the microbiome is to many aspects of health and well-being. And so we often kind of focus on gut health as a foundational principle during our visits. We also provide hormonal assessments and hormonal replacement if that's necessary as well. I would say a large portion of our female patients are postmenopausal and are experiencing effects of that. And so that is a big part of what we do as well. And that certainly also relates to men as well. We know that hormones change through age, and there's some very nuanced ways to assess this and address this, whether it's medication, supplementation, or lifestyle as well. And another area that we really assess pretty much on every patient that we see is what their cardiometabolic status is. And this is important because we know heart attack and stroke, diabetes, right? Those are really prevalent diseases and are associated with a lot of the mortality in our country and around the world. And so I think we do some advanced kind of cholesterol and lipid testing to understand whether all of that is optimal, as well as kind of blood sugar and glycemic control testing and optimization as well. Those are our general visits. We also have some specialty programs that I wanted to highlight. We do have an integrative weight management program, which combines often medication with very kind of detailed follow-up on and tracking of body composition, diet, activity. We have a cancer recovery program, which addresses some of the common challenges that develop from cancer treatment. And then we have an executive and a brain health program. These are both full day assessments where a patient comes in, they undergo imaging, testing, they meet with several different providers for more of a whole person approach to what their concerns are. We also see patients in the hospital, and this inpatient consultation service was started because we really wanted to make integrative medicine more accessible in the hospital setting. This is often when people are hospitalized, this is such a critical time and a motivating time for a lot of patients to make some important changes. And so, if for any patient that is admitted to Jefferson Hospital, they can ask their primary team there to consult integrative medicine, and one of our fellows will come and see you at bedside and kind of do an assessment and make some recommendations. And we often use that as an opportunity to kind of link the patient to some of the resources that we offer at our center. One of our longest standing programs is the Myrna Brin Center for Mindfulness. This has been, I think, in action for 20 plus years. And this offers mindfulness programs and courses. These mindfulness in general, or specifically what we call mindfulness-based stress reduction, MBSR. This is a very unique, well-studied mindfulness program that in essence is designed to help people better understand and to work with all of the stresses in their lives. We know stress is everywhere, but it's more how you carry it. These programs are fantastic for helping you understand that a bit better. I will point people at the end of this talk to our website where you can find all of this information, including kind of free pre-recorded mindfulness sessions, as well as some of our upcoming programs. These are group-based for the most part, so it's a really, I think, good opportunity to understand more how stress impacts you, but also kind of relate with other people who may be going through, kind of similar reactions as well. We also have a very active clinical wing of our department. these are some current clinical trials that we're currently enrolling for and studying. So we're studying to see how the brain is impacted from chronic traumatic brain injury. We're studying the impact of meditation on brain activity using some of our advanced scanners in our Villanova location. And then we're also studying to see how a fascinating nutraceutical called N-acetylcysteine or NAC, essentially an antioxidant that is found in food, how this may help patients with multiple sclerosis with their symptoms. So I encourage all of you to take a look at our website listed here. You'll get more information about kind of where our locations are, how to connect with us, whether it's clinically or from more of an educational perspective. And, we're constantly trying to kind of spread this knowledge to the community. So thank you so much for your attention, and we have ample time for questions now.
All right. Thank you both for that. If you want to take the screen down and we will put you up in big screen here.
Absolutely. Does that look right?
It will in 1 second. There we go. All right. What questions do folks have? Comments?
I just want to say that was great. It was really done.
All right. Jimmy.
My question is about sleep. How effective is using technology, the apps and all, as you're going to bed? My case, I'm on this a lot. I go to get into bed. I'm still on for another hour before I fall asleep. Does it affect? I've heard that it doesn't affect your sleep. Is that true?
So the question is about using trackers to track your sleep.
No. Just going online to the apps.
Like
Oh.
Using Threads, Twitter.
Oh. So you're
Okay.
asking about using your phone
The
before
light.
bed. Oh yeah.
From the phone.
Got it. Yeah, so this goes back to the sleep hygiene point that Dr. Meredith was making. We know that what you do 2 to 3 hours before bed can significantly impact not only your onset of sleep, so how quickly you fall asleep, but also how well you stay asleep and the phases of sleep that you reach, right? So we want to be asleep for a certain duration, but it also matters if we're reaching those very restorative, kind of deeper phases of sleep. And it turns out that being on a phone, a computer, anything that emits blue light, our eyes register that, and then it changes the kind of the chemicals in our brain in a way that we're less able to fall asleep and stay asleep. So, avoiding any blue light emitting devices is certainly an important sleep hygiene practice. That's one part of it. The other part of it is that, you're on an app, you're consuming social media, you're reading the news. None of that really does your nervous system any favors. As we're falling asleep, we want to try to emphasize that rest and digest branch of the nervous system. That's called the parasympathetic nervous system. And consuming this kind of stimulating content, it makes it really hard to tone that branch of the nervous system as we're trying to wind down and go to sleep.
Thank you.
Yes.
One thing on that, a reporter recently wrote that he had set his phone to display only black and white, and was much less attracted to the phone than before. So I'm thinking of trying that myself. I haven't learned how to do it yet.
Julita, can you hear this?
I'm having trouble hearing some of the questions and comments. So if you can.
That's okay.
repeat that.
I will relay. Don was saying that he had read something about a reporter who had set his phone to operate in black and white and was generally less attracted to it.
Mhm.
Which is a fascinating strategy.
Mhm.
Really is. Other question.
Throwing the phone across the room helps too.
Throwing the phone across the room also helps, especially if you read the news. Yes.
Me?
Yeah.
Could be a question for you too.
Sure.
You know, some of the stuff I've been trying to figure out a particular situation with myself. Would it make sense? And how do you get, like, go through an assessment? With, you know, I'm already going to see a rheumatologist in April, but, you know, just, how do we initiate that?
Oh, yeah.
With you?
Yeah.
Yeah,
So that's a great question. And I think we can all kind of chime into that. So just for your info, how does one initiate an assessment to you all was part of the question, or how do we initiate an assessment in general of integrative wellness?
Sure. So, first off, it's deciding whether it's the right, choice for you. I will say that one good kind of metric, right, of whether or not this is something that you would benefit from is, maybe ask your rheumatologist, right, when you see them and say, hey, I'm interested in what I can do with my daily lifestyle. What can I do, outside of maybe the medications that I'm on that are very important? What can I do to help support, this maybe diagnosis that I have? And see whether they offer you some meaningful suggestions. And if the answer is yes, and you're satisfied with those answers, then great. Maybe that's all you need. Maybe you have a specialist and you have a great primary care doctor and they're really filling in all those gaps. But if there's something to be desired from that answer, then this is where an integrative medicine assessment and consultation might make sense. And so in order to do that, it's just simply contacting our office. I on the last slide here, and maybe I'll ask Dr. Danilowitz to kind of send this information out or disseminate it somehow. It's, phone number to our location. You can call and say, I'm interested. Can you tell me what my options are? We have a wonderful intake nurse named Linda, and she will kind of describe the whole process to you, and kind of get things started. And that's essentially how it goes. Telephone or email is another great way to reach us as well.
Thank you.
I'm considering this as opposed to geriatric or gerontology practice, because I noticed that some of the things that I'm dealing with are not being treated the same way, or being dismissed as a oh, this is part of age, versus care, wear and tear that can be addressed for, and what's expected. So I'm trying to compare which of the how compatible the two approaches are, yours and the other. I always see geriatric wards when you're on the way out. That's when they put you into it, and I think that's kind of like missing the point.
Dr. Mitchell, I'm going to let you start with that one.
Yeah.
The question is kind of how does this in geriatrics, like how are they different in a sense? Like, how is the approach different? I also think they can work together, but that's just me because I'm a geriatrician and I'm biased. But go for it, Dr. Mitchell.
Yeah, and maybe you can weigh in on my response afterwards. I'd be interested to hear your thoughts too.
Yeah.
But from my perspective, we see plenty of patients that are, 50, 60, 70 plus, right? That's a huge part of our patient demographic. And many of these patients have an additional primary care provider or geriatrician. And I do think that just like our model, the geriatric medicine model has the luxury of, maybe having a little bit more time and resources or even training to understand the bigger picture. What is your life at home? What does your home look like? What does your social life look like? Geriatricians address these aspects. And so you're probably going to get this type of assessment going to a geriatrician. I think maybe where we can add an additional layer is doing some more advanced testing around certain topics, and then offering more complementary health approaches too. But a lot of this really depends on what is the training and the interest of the actual provider. Maybe the geriatrician has a passion for integrative medicine as well. So that might cover kind of your bases there.
I agree, and again, coming from this as a geriatrician, I'll be honest with you. I think of our field. We in my office, for instance, see folks ages 55 and older, and the whole idea behind geriatrics is, at least at our institution, and we're at the same place, at least in that respect. How do we help? Some things about aging are inevitable, some things, but how do we help folks navigate that age as well as possible? Knowing that every person at age 55, 65, 75, I could see 4 people at each of those ages today, and their needs, their ability to do things, their medical and social backgrounds are all going to be really different. So I agree with everything Dr. Mitchell said as far as you're going to find a wide variety in any field as far as interest. I do think geriatrics does take an interest in that idea of placing people in the context where they are and trying to meet people where they are. So I would not say, at least from my perspective, and I think Dr. Mitchell will agree with this, it's not an either or necessarily. It's to the point where, say, if you're happy with your current primary physician and you want to add in that extra layer of support from integrative medicine, that's amazing. That's great. You can do that. If you're looking for a change of primary, you can still come see a geriatrician and still see our colleagues in integrative medicine. They are not mutually exclusive.
Correct. Another common, I would say, reason people come in, in the later decades of life is with the questions, hey, I've been on these medications for a long time now. Am I doing everything I can to support these things that I'm medicating? And if so, can we optimize these other factors and potentially decrease the dose or come off of a medication even? And in that way, we do align a lot with geriatrics, because I know that, again, one of the focal points is trying to avoid too many medications building up over life. And so we do align on that as well.
I always say, I use this phrase for myself and my colleagues, that we are appropriate medical minimalists, meaning medicines that just because you've been on it for 30 years doesn't mean we can't make adjustments, doesn't mean we change everything all at once. We love this idea of deprescribing in geriatrics as well. We can take people off things that they don't need or that are not helpful or that are harming them. We do it.
Exactly. And we want to partner with the patients in order to kind of reach that goal. If that's important for them, then, maybe we do trial a period of time off of a medication, check some labs, monitor symptoms. That is okay. And we have frequent check-ins to make sure that these things are being monitored.
Yes, Tom.
Are we covered? Like you say, you have a plan with Jefferson Health. Are we covered in that? Or is that separate?
It is separate.
Okay,
It is. It's a fee-for-service model for integrative medicine.
okay, thank you.
What does that mean?
So
Sorry, Dr. Mitchell. The question is just, how is this covered, basically?
Yeah, so we have several providers in our practice. Majority of the providers are fee for service, meaning that just like, most seeing, sometimes a psychologist for talk therapy, some people pay out of pocket for that based on the amount of time with the provider. That's the majority of our providers model here. We do have some insurance covered providers and services. I will say the nice thing is that Medicare does cover not the patient visits themselves, but several of the kind of specialty tests that we often order, taking a deeper dive into things like nutritional status or gut health.
Any other thoughts, questions, concerns before I let her? Yes.
Well, considering the payment structure and the tests payments to Medicare, could our primary care doctor ask for those tests, which would then be integrated into our patient visit? I'm trying to kind of get around the
Yeah.
structure, is that
Good question.
kosher?
Yeah, so these tests are not, these advanced tests are not always needed. So that's the first thing. Are they appropriate? And I think that's part of what we use our first kind of initial visit to figure out where we should put our time and our resources. But if they are deemed appropriate, I think what makes kind of our field stand out in a bit is that we're very comfortable and familiar with these tests, while someone who's more in the kind of standard primary care space isn't. And so maybe they're able to order them if they but if they do, they may not feel comfortable interpreting them because they don't do this day in, day out like we do. So it's really a case by case basis.
Thank you.
All right, everyone. I will let our
Thank you,
colleagues
doctors.
go. Thank you so much for joining us. We really appreciate it.
You're welcome. Enjoy your days. Bye.
Have a great rest of your day.
Thank you all for coming. What a great crowd. We had, I think,